just went in for my regular test in August, and they found something on the sonogram part of it actually that was a little suspicious. And so September 19th, I went in for a biopsy, and this is frequently done, so I really wasn't expecting it to be anything abnormal, but it came back with some cancer cells in it. That my mother makes when I'm sick, since I was little.
It's very hot.
It's potato soup, homemade potato soup. So I'm
Yeah.
gonna go buy that. Yes, very good.
Is that what we remember?
Perfect. Well, I'm a women's health nurse practitioner, so that's what I do every day is work with women, and they're making sure they get their mammograms and their screenings and things like that they're supposed to get done. And so you never really think it's going to be you that it happens to.
I mean, I remember they told me I think it was a Friday, and then that weekend I was just wasn't like upset about it. I was just more like, I mean, this is serious. Let's go, good or bad.
There's a lot of decisions that have to be made in a very short period of time, and so there's a lot of really good information that you'll get from your original biopsies about the type of cells in the cancer, the type of tumors, and some of them are fed by estrogen, and some of them are, so there's different biomarkers is what they call it, to tell you how aggressive the cancer actually is. Then you have to go to your professionals, your physicians and your radiologists and stuff, and make the decision about what type of treatment you want. As far as surgery, sometimes they can just do a lump and take that out. Sometimes they can take just one breast, and sometimes they can do a full mastectomy, and a lot of it's based on your family history, the biomarkers or the type of cancer it is. Mine actually was very, very small and could have easily been just removed from a tiny lump, and I could have gone back to work sooner and everything been fine. But because I have a lot of family history and I have really dense tissue, I decided to go with the full mastectomy. But the interesting thing is they actually found that my cancer, even though it was less than a centimeter in size, has already spread to a lymph node, which is very unusual. And so that affects your decisions too, because if it goes into lymph glands, then it can move to other parts of the body. So it was also God kind of intervening, I think, and putting me in the right place with the right surgeons, with the right doctors, and making the right decision to get the mastectomy, because now hopefully after my surgery the other day, I'm cancer-free at the moment. If they don't find any other cancer, I'm fortunate enough that they found it early that I can avoid the chemotherapy and radiation. If there is a few more lymph nodes with cancer, I may have some other treatments to have to do.
Well, she doesn't want to take medicine because she's so strong and brave, but she gets up and puts on makeup every day because she wants everybody else to be comfortable. And my job is to offset it by trying to make her comfortable, but it's been the least disruptive thing I've ever seen.
I mean, the community's been great. My coaches, my teammates, and teachers have all gathered around to ask if they need any help or with anything. But I mean, coming home and seeing her, I mean, it's great. I mean, it's just like normal, but I know that, I mean, it's a lot special to her just to be able to see me and see me be happy and stuff.
I'm actually a nurse practitioner. I work for UT Health Center, and the ironic thing is that I do women's health care, and so it's something I've always stressed to my patients, that it's always important to go and get that mammogram every single year, and always to be checking, you're doing the self-breast exams. I think a lot of women aren't aware that there's many programs out there that help provide free care for breast cancer screening. There's 3 of them that I work with every day at UT, the breast cancer, cervical cancer screening. There's Healthy Texas Women, and then there's a grant that's just through UT, so anyone from about age 16 to 64, citizenship or not, I mean, any woman has access to care through that program, and they can get all the mammograms and follow-up that they need. And then usually once a woman becomes diagnosed with an actual cancer, there's actually a Medicaid that pays all the bills for the treatment for the breast cancer. So there's excellent programs out there, so women don't have to be afraid, to go in and take care of themselves and get those treatments because they're worried about cost, because there's always a program. There's really no reason not to get your mammograms. I had my normal mammogram. It wasn't something I thought, wasn't something I felt, wasn't something new. I just went in for my routine screening, and there it was. So if I'd skipped a year, I'd have been a lot, further along in the cancer diagnosis when they found it. So
I had school that day. It was Friday, but I got out at 1:30, and I rode with my aunt and uncle up there, and I saw her after the surgery, and I talked to her for a little bit, and we stayed at the hospital for a while, and then I went back, and I called her that night, and we talked. But yeah.
yeah, I didn't really want him, sitting around worrying about me at the hospital. Hospitals aren't very fun places, and so, like I said, as a mom, I think a lot of times you worry more about other people worrying about you. So I just wanted him to be able to go on and be as natural and normal in his life as he is, because I know it's already on his mind. It's difficult sometimes to accept that it's really happening. It happens suddenly, and you don't really necessarily feel sick. You just wake up and they tell you you've got cancer one day, and so it's a little bit of a difficult adjustment.
The community's been great. My coaches, my teammates, and teachers have all gathered around to ask if they need any help or with anything. But coming home and seeing her, it's great. It's just like normal, but I know that it's a lot special to her just to be able to see me and see me be happy and stuff.